Can we swap positions?
Yeah, sure.
I prefer this.
Yeah. No one.
Speak like that. Okay.
Okay.
Hmm.
Let me see if they're ready.
Okay.
Okay, Your Excellency Hasmani, thank you very much for your panel. It was very insightful. We just wanted to ask you a question regarding healthcare in Lebanon. So basically, how do you go about improving healthcare? How do you support impact investors? What is the level of impact investment actually in Lebanon?
So look, Lebanon is an entrepreneurial country. There's a lot of attraction to private investments in general. Impact investments are not very common, but they're becoming more and more common today, particularly in healthcare, where we're open to innovation, particularly in primary healthcare, where it's a partnership between NGOs, private investments, and the government. So we've launched the part of the government that can help evolve primary healthcare, has been focusing on putting regulations and accreditations to unify the quality across healthcare, primary healthcare centers. But at the same time, we also managed to attract a lot of people who are willing to invest in this area, either for investment purposes or as NGOs, because we facilitated the infrastructure, we facilitated the uniformity of services and the guidelines for how to operate and manage. And we provide them with support, any global support that comes to the country, either through the WHO or any global organizations, are put at their disposal through a well-organized national program, which makes it more attractive and easier to invest in this area. And in terms of medical innovation, again, medical tourism is a very attractive area in Lebanon. Regulations around care and hospital care and private hospitals are fairly open to facilitate investment in private healthcare as well. So the government, for example, funds health treatment in tertiary and secondary care in private hospitals as well as public hospitals. So it's not kind of centralized, which helps the growth of private hospitals in Lebanon, who can also be self-funded by doing their own work, but they have a big chunk of their revenue coming from public spending, covering those who are publicly covered by the healthcare system.
So I believe this is a similar system that they have in the NHS as well, because they have the basically private hospitals being funded by the government. Yeah.
Yeah. So the whole idea is to have a pay-per-patient model across all care providers, whether primary, secondary or tertiary care, which basically helps them survive and thrive, and at the same time lowers their cost base and makes the return on investment better, which then improves quality, improves the attractiveness of this field to foreign visitors, to health and care tourism, as well as elevate the quality of service. So Lebanon was ranked #1 in the Middle East in terms of health service quality, and that's because of that system, basically.
I see. All right, thank you very much.
Thank you. Best.
Right.